Dr. Benson, the owner of Paws and Grace, and I just wanted to talk a little bit about breathing emergencies. I see this a lot at comfort care or hospice appointments where owners describe that their dog or their cat is just panting. And it's really sad because owners don't recognize an emergency. So the big diseases that are going to be at risk for breathing emergency is heart failure, lung tumors, that can be primary lung tumors or when they've spread to the lungs from other places, other organs, pneumonia, and dogs that have pneumonia may have coughing, nasal discharge. The big at-risk diseases for pneumonia would be if your dog isn't getting up, with degenerative myelopathy or neurologic issues, and pleural effusion, fluid around the lungs and the chest cavity. This can be, cats get this with heart failure, cancer. Those are the big ones. There are other diseases that also cause breathing emergencies, but these are the big ones that we see in hospice appointments. This is my friend Winter. We're going to go over what normal breathing looks like. I think it's really important that all owners are able to recognize. So her gum colors should be nice and pink. I like to think of it as bubblegum pink. This is what we want to see. Not a muddy wine color, not a light blue, not white. So if we lift up her gum, it's nice and pink. Tongue should also look pink. Her breathing rate should be less than 50 breaths per minute. So up and down is 1 breath. I'll put my hand and count. In 10 seconds, multiply by 6. It should be less than 50. Her effort should also be not increased. So she's not breathing with her belly. She's not putting her head or neck out in extension. These are all the things that you're going to look for normal breathing in cats or dogs. This is my friend Graham. He's a little wild. So we just ran him around to demonstrate respiratory distress. So he is actually panting, but if your dog was not very active, then this would be a sign of respiratory distress, panting like this. That's not appropriate. His gum color is nice and pink, bubblegum pink. That's what we like to see. But if the tongue were white color or the gums were muddy wine color or a light blue with this type of breathing, that would be considered respiratory distress. Also, his rate is increased. And a lot of times owners will tell me, oh, their dog's just panting. So if they haven't just run around, this is not appropriate. This is a sign of a breathing distress, and his head and neck out in extension, not nice and comfortable. So all signs of a possible respiratory crisis.